board members are out of town. Some of them got gigs. They just could not be here tonight, but they're here in spirit. Anyway, before we begin, we'd like to welcome our newest and youngest members of the Musicians Union in New Orleans, Mr. Israel and Emmanuel Mitchell. There they are. Stand up, yeah. And they are brothers, real brothers. And they're both trumpet players. I had the distinct honor and privilege of meeting them at the AFL-CIO picnic that was on Labor Day, and they tore the place up. Anyway, we'd like to thank everyone for coming out tonight. I'm indeed pleased with the attendance, and we have several important issues that we're going to present to you. Okay, Maestro. Oh, beautiful, for spacious skies, for amber waves of grain, for purple mountain majesty. Suspend the rules of order, and we're going to present our first speakers to explain to you about the Affordable Health Care Act. Without further ado, let me introduce Wade Ratke and Anna Young to explain to you more about the Affordable Health Care Act.
What a great way to start a meeting. What an honor to be here. Wade Ratke, I'm Chief Organizer of Local 100 United Labor Unions. This is Hannah Young, who's one of our organizers. When they passed the Affordable Care Act, we represent largely service workers. As many of you know, I've been here before talking about organizing, who often don't make very good wages and don't have health insurance. We saw this as an opportunity, so we joined a collaboration with neighborhood groups and others working in Arkansas, Texas, and Louisiana to say that we would help be navigators, as they're called, to enroll people. We've guaranteed we're going to see 2 million people over the next year and get them to enroll in the Affordable Care Program. So luckily y'all get to be the first 34 or 35 people we get to see face to face. Here's what I'm going to do. Everybody got these flyers? So our job, we go through some training with Health and Human Services to be certified as navigators. I actually will tell you later, but I talked to Megan at the clinic about also becoming a certifier. She was trying to figure out how to do that. It'd be great. We're going to help facilitate her being able to do this so that she can also help enroll people right at the clinic. But let's be honest. A lot of information is not out yet about the Affordable Care Act. So there's a lot of confusing information. Here's the bottom line. Beginning October 1st through December 15th is the first enrollment period, either by paper application or online at www.healthcare.gov. That's on this flyer that we passed out. That enrollment period, if you get through the process and have paid your premium to a local insurer as part of the marketplace exchange, means you'll have coverage January 1, 2014. If you at least enroll before the 31st of March, you won't have to pay a penalty for not having insurance within that year. How many of you have job-based insurance through your employer? Okay, so 3 or 4 of you. If you have job-based insurance, you will not be able to apply through the marketplace. The rest of you, listen to me carefully. If you look at this chart in the middle of this flyer, we did, an hour before we came, just because we're trying to focus on it. This is the Federal Poverty Level Index. In this particular program, if you and your family are anywhere less than 400% of that guideline, you'll see that in the last column, for your family income, you are going to be eligible for some level of subsidy going into the marketplace, either on what are called premium tax credits or cost sharing. A tax credit, if you're eligible, will either be paid directly to your insurer, whatever insurer you choose, so that your premiums are lower with whatever policy you've selected, or they will be given to you at the point you file your taxes with the IRS in April, at that point, as a tax credit. Cost sharing has to do with, if you're eligible for cost sharing, lowering the participation of the government and lowering your cost for deductibles or copays. So if normally a visit used to cost so-and-so for some procedure, it'll now cost Y instead of X because it'll be subsidized. The reason you want to enroll is not only because you have to, that's the law now, and there are penalties. This year you can say, well, the penalties are nothing. It's 1% of your gross income or $95. 2014, it's 2% of your gross income, almost $400. 2016, 2016 it'll be 2.5% or almost $700. That's if you don't bother to enroll. But once you enroll, once you go on, put your information, and you have to have 4 or 5 things when you come in to either enroll with us or go right on the website, www.healthcare.gov, or you can do it yourself after October 1st, is real-time eligibility. So you will almost immediately know, are you eligible and what kind of benefits you could be receiving. So this is it's crazy not to enroll. Even if you choose not to get the insurance, even if you aren't sure of what you want or whatever, or think maybe, I was talking to an individual before the meeting started, he has personal insurance. Well, if he's under this guideline, even if he chooses, if his insurance is either compatible or one of the 5 companies participating in the exchange, he may have exactly the same insurance he has, except it'll just be cheaper for him. So far in other states, the surveys are indicating if you're a single individual below 35, it's likely with the subsidies, if you fall into this chart, that you would be paying somewhere between $100 and $150 a month for insurance. For some reason, from 55 to 65, you may be paying, in Ohio, there's recently a survey, as little as $30 to $50 a month for your insurance, which is totally different than the way health insurance has been, when you would get people off who couldn't get it if they'd had pre-existing conditions or this, that, and the other. The other thing that we're going to pass around is a sheet for anybody who wants more information. Obviously, we just grabbed it. We've ordered all the information from HHS. Unfortunately, it isn't ready for prime time yet. So we've ordered applications, literature in English and Spanish, 10 different brochures. Absolutely none of them are available yet. So what we're passing out is an HHS flyer that we got off of their website, an enrollment flyer on a PDF. So, but if you see yourself on this chart, you already know that you are likely, everything being equal, to have subsidies of some kind or another, tax credits waiting for you. You also may, based on your family, find out that part of the problem here we have in Louisiana is in many states, about half the states, there's Medicaid expansion. That did not happen here. So many people who've never been able to get full coverage would have been getting coverage. But that doesn't, we still do have programs that affect children, so it may be that you didn't realize that children you have in your family based on your income are eligible for CHIP or some other kind of program which is available. So this would be something that once you enroll will automatically also enroll you at the state level in that program. Yes, ma'am.
We keep talking about this chart, and maybe I missed something, but is this the number of people in the household on
The
the left?
left-hand column is the number of people in the household.
And is this the salary of the two combined incomes?
If you're looking at the two,
Well, these numbers, what are these numbers? Are these
100% is what the federal poverty guideline is. 133 is 133% of the federal poverty guideline.
So the 11,000 is the combined income of these two people?
No, 11,000 would be one person.
15,000 would be two people.
Two, okay, that's what I mean, each person, that's what I
Right. So that's in the first thing. But for example, let's say you're one individual and you make less than $45,960. If any of you only make or do make $45,000, you're going to be eligible for some form of subsidy, either tax credits or cost sharing through the exchange, through affordable health care. So I think a lot of people are surprised. They thought, oh, well, this probably isn't for me. But let me tell you, I don't know anything about all of you. I can tell you about our members who are service workers and, are sometimes making $8, $9, $10 an hour. Virtually every one of them falls in this chart somewhere. I mean, the truth is, if you're one individual, you have to be making $21 an hour to be, I'm working 40 hours a week, 2,080 hours a year to be over that level.